you see a significant relationship such that the more your anxiety drops after floating, the greater the reduction in connectivity between these two regions. In some ways, this is the most exciting part of the data, because what it suggests is this signal right here is giving us some information about a person's subjective state. And it can tell us how successful the float was on a patient-by-patient basis. So this was very exciting. Let me tell you some more reasons why I'm excited about this finding. Anti-anxiety medication. Study in 2007 looking at, it was basically an experiment that had people undergo pain. And essentially what they found is when you take an anti-anxiety drug, it was a benzodiazepine, and administer it in a placebo-controlled way, you get a significant reduction in these two regions. Guess which ones? The dorsal anterior cingulate and the right anterior insula. We did a study back in 2006 giving the drug lorazepam, another benzodiazepine, anti-anxiety drug, and once again in a dose-dependent manner, you see a drop in activity in the dorsal anterior cingulate. So we're hitting the same brain regions that anti-anxiety drugs are modulating. Kyle Simmons gave a talk last year, and if you don't remember it, I encourage you to watch the YouTube video. It was a great talk. But a big chunk of the talk was trying to discuss what are these regions doing? What is the anterior insula doing? What is the dorsal anterior cingulate doing? And what Kyle actually did is he created a theory called the EPIC model. And what he showed is that these regions are constantly communicating with each other. And the nature of their communication is about predicting your future body state. Not how you're feeling right now, but how you're going to feel a moment from now. And these are the regions that seem to be dysfunctional in people who suffer from anxiety. They're in a perpetual future state in their mind that is totally disjointed from how their body is actually feeling. And this is really the kicker, you guys. Last year, this study was released in JAMA Psychiatry. Identification of a common neurobiological substrate for mental illness. They took 16,000 individuals across 193 different studies using a technology known as voxel-based morphometry. It's looking at the structure of the brain. And they said, irrespective of diagnosis, in the sample are people with schizophrenia, bipolar disorder, depression, OCD, anxiety. They included everybody with mental illness. Irrespective of diagnosis, what are the regions that are most heavily implicated across mental illness? Take a guess.
Salient network.
The dorsal anterior cingulate and the anterior insula. So this is very promising, you guys. I think we're clearly modulating functional connectivity within the brain salience network. It's going down after you float. Okay? But this is the most important part. We're hitting the very circuit that we think is vitally important for mental health. In the field of pharmaceuticals, they call this target engagement. And this is very preliminary, but we think we're engaging this target in a very active way. And then the degree of reduced post-float connectivity was correlated with the degree of post-float anxiety reduction. And this could be a potent biomarker for actually studying the anti-anxiety effects of floating. So, to wrap things up, this is where we're headed. There's a lot of studies going on. I'm pleased to announce Liger has finally started clinical research. We had to get our feet wet, so to speak, with healthy brains, learn a lot about how to do this research, but we've begun some pilot trials. PTSD, panic disorder, and anorexia nervosa are some of the populations we're working with now. And actually, later today, you're going to hear about the first data coming from the anorexia nervosa study. We're looking at combination treatments as well. We're starting with just floating, but we're also interested in combining things. One of the things I'm particularly interested in is meditation and teaching patients how to breathe in a very particular way while they're floating. And one of the things this requires is actually very precise sound. So if there's any audio gurus in the audience, please come see me because we're trying to get the sound perfect in our float pools. And then, this is the exciting part. Typically, in the field of mental illness research, you study how to get people from, -3 back to 0, how to get rid of their symptoms, right? Floating does a lot more than that. Floating enhances mental wellness, and this is something I think we have the opportunity to do above and beyond just saying we're getting rid of symptoms. We're actually giving people greater happiness and well-being in their life. And we're interested in trying to understand how this works, how long it lasts for. Beyond just clinical research, we want to know the basic science. How could we characterize this relaxation response? I think a lot of you are going to be excited about the study we're going to present next year at the conference. We're measuring magnesium levels before and after floating longitudinally. And Shoshana Liebner was critical in helping us get funding from the Epsom Salt Council to pursue this. But next year, we're going to be able to actually unveil how much magnesium the body may be absorbing during the float experience. We're also very interested in the physiology, what's happening in the heart, what's happening in the lungs. Later today, you're going to hear a talk about how we're measuring all of these different variables. And we have many fMRI and EEG projects still to come. In fact, we're going to be submitting the results I just showed you today for publication in the next few months. And if any of you are interested in keeping up, we just added this to our website. It's an email list. You sign up, and when the study comes out, I'll email you a copy of the study. So please feel free to sign up on our website for the email list. So, when I look at this on the horizon slide, it's daunting. It's like, how the heck are we going to do all this? But the truth is, as you guys know, it's about creating a community. This is what floating is about, and research is no different. And over the past few years, I've been so lucky to have a community of people supporting our lab and the research in our lab. This is just a few of them. You have Saib and Martin and Kyle. Those are the researchers I work with on a day-to-day basis. But then you have people like Ricardo Gil da Costa, who's going to come give a talk tomorrow on EEG and floating, who came out of the woodworks and now is an integral part of our lab. And you have people like Jim Hefner, who you heard from this morning, that are helping us conceptualize how this could actually help the industry. How could the research we're doing actually benefit what you guys are doing? And you have a whole slew of people, too numerous to name, that have come through and really provided the community we needed to do the research and answer the big questions. And the truth is, none of it could have been done without the lab, the people who come in every day and do the research. You have Kaylee, you have Obata, Han, Will, Colleen, Aisha. And I can tell you, the Float Clinic and Research Center is an international endeavor. We have representation from every corner of the planet up there. And our most recent addition is Pan Lin. He arrived here 3 weeks ago from China. In fact, this is Pan getting off the airplane. All he had was a suitcase in his hand and a backpack. He left his home, his family in China to pursue this research because he believed in it. It was a 2-year process to get Pan over here. But I'm so excited that the next talk is going to be Dr. Pan Lin. So thank you guys. I'm so excited to present these findings. You're the first people to see them. Haven't presented this data anywhere else because we only discovered it about 2 weeks ago. But without further ado, please welcome Dr. Pan Lin.